Il n'y a personne qui choisit d'être malheureux dans la vie. Il n'y a personne qui choisit d'être un consommateur régulier là, et dépendant. On veut s'en sortir. Tout le monde veut s'en sortir. Puis ça, la réduction des méfaits, c'est possible aussi. La réduction des mythes, des faits et des risques, c'est très, très, très possible. Puis c'est ce qu'on fait, nous. C'est ce que plusieurs organismes font. Et puis, ben, il faut les subventionner. Si vous êtes tanné de voir des objets, des seringues de traîner, des pipes, tout ça, ben, au lieu d'empêcher des sites de consommation à ouvrir, ben, plutôt de les encourager. Parce que c'est prouvé qu'à chaque fois qu'on fait un site de consommation supervisée ou un organisme communautaire qui distribue du matériel de consommation, c'est prouvé qu'alentour, ben, ça disparaît. Il n'y a plus de seringues à la traîne, il n'y a plus de pipes à la traîne. En tout cas, de beaucoup moins. Fait que c'est ça. Fait que encouragez-nous, laissez-nous vivre, s'il vous plaît. Et puis, ben voilà, tu sais, parlez-en à vos députés, tout le monde, c'est important. Ça sauve des vies. C'est clairement que la réduction des méfaits et des risques, ça sauve des vies.
My name is Timon. I'm the responsable, I guess, responsible person for events and communication at AccuPaySud.
And so what is AccuPaySud, if you can give us a brief rundown of it?
Yeah, so AccuPaySud is basically the association for the promotion of for the promotion of the health of people who use drugs in Quebec. So it's basically an association of people who use drugs working to improve the health and lives and well-being of people who use drugs in Quebec. So it's a provincial organization, so it's made up of members all across the province, but then we're headquartered in Montreal.
And what are some of the tools that you offer? Because I see there's some tabled over there.
So we have a bunch of stuff. We have a program that deals with people who use drugs in prisons. We also have, so we go into prisons and stuff and do outreach and whatnot. We also have educational tools. So there's our magazine, L'Injecteur. There's the Le Blender, which is kind of a guide on how to mix drugs. And then we also do political activism or lobbying. So like right now we're fighting PL 103, which is a law the government is trying to pass, shutting down supervised consumption sites in the province. And then last but not least, we do events like this, like the Journée Internationale de Sensibilisation aux overdose.
And what makes you do this event every year? What makes it important?
Yeah, so we do, in English it's International Overdose Awareness Day, and we do it every year because, well, there's a few reasons. Number one is like to raise awareness about overdoses, obviously. It's still very much stigmatized, it's still very much an issue. It's a crisis that keeps getting worse. And so we're trying to raise awareness about that, reduce the stigma and stuff. The other part of it is also it's a great opportunity to bring everybody together that works in the sector, like for us to get together, to see each other, to kind of fight a bit of the burnout that a lot of us are feeling working in this sector every day. So it's kind of a little bit of team building, so to speak, and then also an opportunity just to raise awareness at the public level.
And if I understood correctly, this event is held since 2013 every year?
Exactly. It's been held since 12 years. Yeah.
And what are some of the messages you hear from the witnesses that are able to participate in the open mic?
Yeah, so it changes from year to year. I think this year we're going to hear a lot about PL 103, which is the law that's trying to shut down supervised consumption sites. We also hear a lot about the death toll and the human toll and the suffering that's caused by this crisis. And you know, a lot of us have like dozens of friends who are dead, and it just gets worse every year. And so it's kind of that fatigue, I think, that a lot of people are feeling that we hear. year in, year out, basically. And then it kind of depends with the current event. So as I mentioned, this year with PL 103, and then kind of the political backlash we're seeing against harm reduction in general. Yeah.
So what are some of the ways to prevent deadly overdoses?
So there's a few ways you can prevent death by overdose. I mean, opioid overdose is my favorite overdose because it's completely preventable. Like, nobody has to die from an opioid overdose. If you have naloxone and you're not alone, you don't have to die from an opioid overdose. Like, naloxone can reverse any opioid overdose. And so as long as there's somebody around you who has naloxone, it's okay. Like, you still have to call 911, obviously, but it's preventable, the death. What sucks right now with the current toxic drug crisis is that it's not just opioid overdose anymore. It's like mixed substance toxicity. So we're seeing like a lot of xylazine, we're seeing a lot of benzodiazepines, and naloxone doesn't work on those. So people are dying from substances that naloxone doesn't respond to and that we don't have good antidotes to. So that's kind of the big problem with the current drug toxicity crisis, is we just don't have good tools to respond to it, which is of course where legalization would come in, but we're a long ways from that, unfortunately.
And do you know what some of the tools would be for these drugs that naloxone cannot negate?
Unfortunately, current medicine just doesn't have good tools for them, like benzodiazepines. We do have an antidote, but it causes seizures, so it's really only used in hospital settings. So like, for the current drugs we're seeing on the street, number one, we don't have good tools. Number two, it's constantly changing. Like, as soon as they would come out with a new antidote, the drugs would have changed on the street. And so it's just like a game of whack-a-mole. So you really have to treat it at the source of the issue, which is number one, obviously the reasons why people use drugs, but then also legalization to just get rid of the fucking awful drug supply that we have right now. Yeah. Sorry, I hope you can believe that.
Yeah.
I did have a question in terms of
Naloxone, yeah.
Sorry.
No.
I think you can get it at like.
Yeah, you can get it at any pharmacy in Quebec. It's offered for free. If you go to our website, acupsud.org, there's a link to the Government of Quebec's portal that shows you where you can find it nearby you. It's been available in Quebec for several years. I'm not sure the exact date, but it's been available for free everywhere for several years. You can get it at pharmacies, you can get it at community organizations, you can get it at some hospitals will give it out as well. So it's pretty widely available. Most people who use drugs have access to it, or at least have it on them themselves. I see so many people on the streets these days with their own little naloxone kits, and that's awesome to see. It's just, it's not enough anymore, the naloxone itself. So.
And you were talking about the stigma of it. So having an event like this, what are you hoping to get from the public? Do you think the public is attending this event, or is it more of the community still?
So that's a great question. It's definitely more of the community that attends these sorts of events. I really wish more of the public would attend these sorts of events, because it would also give them the opportunity to interact with people who use drugs and to kind of see that they're not just monsters, but that they're actually human beings with stories and lives and stuff. Because what I find so often is that, like, once you talk to somebody who's stigmatized, it's a lot harder to stigmatize them. It's so easy when you dehumanize somebody to think less of them, but then once you're confronted with them face to face, it's a different story. So that would be kind of my wish for the event, but at the broader public level, it's basically we're trying to raise awareness, number one, of PL 103 to really put some pressure on the government to not pass this law, which is going to decimate the people who use drugs, because people are already dying, but if you take away the few spaces they have where they can actually use safely, the death toll is just going to be that much worse. So.
And do you see large numbers of people that actually participate in the safe injection sites?
Yeah, Cactus is full like every night. It's if anything, we need more supervised consumption sites. There's definitely enough demand for it. Like a big reason why people wouldn't use supervised consumption sites is because they're so sterile and hospital-like. So I would really like to see more sites like what they have in BC, where it's kind of more homely, less clinical, more kind of like a welcoming space. Especially for people who have trauma related to healthcare institutions and stuff. But in the absence of that, we at least need the supervised consumption sites we do have, because taking that away is just going to mean needless death, but also disorder in the community. Like, you're going to have used syringes lying around, you're going to have people using in public spaces again. Like, I think people forget what things were like before the supervised consumption sites. Like, yes, it's so scary to have a supervised consumption site in your neighborhood, but the people are going to use regardless. Wouldn't you rather it be in a controlled setting? So.
And when it comes to having drugs legalized,
Yeah.
How realistic do you see that being? Because that's right now you do say the kind of the movement today is to
Yeah.
ask for these or to take away the law.
Well, it's a focus on public safety. It's kind of a bit of public hysteria in reaction to public disorder, and so it's kind of this backlash against that where the public feels unsafe, and so they're willing to kind of throw the baby out with the bathwater.
But legalizing drugs, do you see that as being realistic?
No, not in the short term, certainly. I think we'd love to see it in the medium to long term. I recognize that in the short term, that's not likely to happen in the current political context. Partly just because it's such a liability for the like it would expose them to so much political vulnerability. But it just sucks because that's really one of the most comprehensive solutions we have to the current drug toxicity crisis. Like if we legalized it, that would solve so many issues.
Well, for many people, I'm not sure if they're aware of what the changes would be
Right.
if the drugs were legalized. So could you talk about some of the benefits from
Sure.
legalizing drugs?
Yeah, so if we regulated the drug supply, number one, the drugs would be of a known quantity and quality. So right now when you buy drugs, number one, you don't know how much you get, but you also don't know what the purity of it is. And you don't know whether it's the substance you actually bought or whether it's a contaminant or whether it's an adulterant. You have no idea. You can get your drugs tested, but even that is not a surefire solution. And so that's really what's driving a lot of the death we're seeing is the fact that people have no idea what they're using, and so it's impossible to be responsible with their use. Because even if they wanted to be responsible and use in the presence of somebody who has naloxone, don't use alone, all that stuff, use at a supervised consumption site, they're still exposing themselves to risk because they don't know what it is they're consuming. So legalization would solve that immediately by removing the black market and giving people access to it. Like a pharmacy, right? You know, you go to the pharmacy, you know exactly what you're getting, what your doctor ordered, and you're sure you're going to get that. So that would be the biggest thing. But then
Would these drugs need to be prescribed to people?
So there's a few different ways legalization could work. It could be in a medical model, as you said, where somebody is prescribed the drugs, and so kind of people who are addicted will continue to get the drugs that they're addicted to, and people who aren't won't. The other way it could work is kind of like what we do with alcohol and tobacco, where it's kind of accessible to everybody, and then maybe you can only get higher quantities or qualities if you have a medical prescription, something like that. There could also be different tiers of it, where, you know, harder drugs like opioids are reserved for prescription. Softer drugs like maybe weed and ecstasy and stuff could be more widely accessible. So there's different ways that could work. That's really, to me, the smallest issue. The biggest hurdle is just the political inertia to legalization.
And I'm sorry, you were saying other benefits and I cut you off. I
Yeah,
don't know if
no.
you remember what you were going to say.
No. So it's beyond the known quality and quantity. It also gives us the chance to see who's using drugs, like see who has a problem with their drug use or who's using a lot of drugs, and give them access to treatment if they wanted it, or give them access to alternative substances that maybe are less toxic or less detrimental to their health. Like it really gives us the chance to let people use in a framework rather than just the kind of free-for-all you have with the black market. So, and then beyond that, obviously you have the tax income, which could be used to fund more treatment and which could be used to fund other public services. I mean, to me, legalization just is like this holy grail that just doesn't have many downsides to me, because all the downsides can be mitigated through good policy, but it's just people freak out when they hear the idea of legalizing hard drugs, right? They're like, oh, that means my kid will be able to buy heroin at the superstore, which is like, that's not really what we're talking about.
So do you think it would be, if the government ever did this, federal government, legalized drugs, would they need to contact or consult with groups like yourself?
Oh, I would certainly hope so. I mean, I really believe that nothing about us without us. Like, I think it would be, number one, very likely to fail if they didn't consult people who use drugs in the development of policies for people who use drugs, but then also they just don't know what they're talking about, right? Like, you have a bunch of old white guys in Ottawa who are 70 years old who have never heard of fentanyl, developing policies to combat fentanyl and nitazines. Like, that I just don't think that's likely to turn out well. So I would certainly hope they consult organizations like ours.
I do have a question. So
Yeah.
you mentioned, the public advice on law.
Yeah.
And then you mentioned like how you don't really get any support from like the government.
Yeah.
But have you had any like city councilor or anything like that showed support?
So we do have some politicians we're working with that have shown support, if not publicly, then privately, for our efforts and that are sympathetic to our cause. I'm not going to name drop anybody, but we do have some support. It's just, unfortunately, if the government is really determined to push it through, we just lack enough of a political clout to be able to really block that in any significant manner. So that's really why we're trying to reach out to the public and try to get the public to hear our message and to in turn put pressure on the politicians, because otherwise we just don't have much that we can do to block that otherwise, which is the way it's basically always been when it comes to people who use drugs. They're just marginalized and pushed to the side, and policies are made on their behalf. That's the entire history of people who use drugs, basically. So unfortunately, it's more of the same.
Thank you.
Cool. Thanks, guys.
Alors, je suis sœur bicyclette de la Sativa Parlante. Je fais partie des sœurs de la perpétuelle indulgence. Et, nous sommes un mouvement laïque qui représente un peu des sœurs, oui, mais nous sommes des sœurs pour la communauté marginalisée en général, le LGBTQ et tous les marginaux de la société. Voilà.
Parfait. Et justement, pourquoi vous êtes ici aujourd'hui? Qu'est-ce que vous avez poussé à venir et participer?
Ben, ça fait partie de mes vœux en tant que sœur. Moi, je m'occupe, je fais la défense des droits des personnes qui consomment des drogues. Et puis aussi, c'est ça, je défends aussi les personnes en situation d'itinérance, les personnes séroppositives. Ça fait partie de mes vœux. En tant que citoyen aussi, j'ai eu un certain passé de consommation. Et puis, je suis solidaire avec ça. Mais je serais solidaire même si je ne serais pas un consommateur. Je trouve ça aberrant que des gens meurent tout simplement à cause qu'on coupe des subventions ou on coupe 1,5 milliard dans Santé Québec. Je trouve ça aberrant, vraiment. C'est pour ça. Là. C'est pour, en fait, pour réveiller les gens. C'est ça. Pour que les gens comprennent que nous sommes tous des humains. Nous sommes tous des humains. Puis on a le droit de vivre. Caroline de Belle. Voilà.
Tantôt, durant votre speech, quand vous avez ouvert l'événement, vous avez mentionné aussi un manque de compréhension par rapport à la honte. Les gens emmènent la honte à la consommation. Est-ce que vous pourriez me parler un petit peu plus de ça?
Ouais. J'appelle ça aussi l'autostigmatisation. On reçoit beaucoup de jugements de la société. T'sais. Ah, c'est un maudit drogué. Ah, c'est un scroté. Des choses comme ça. Mais à force d'entendre ça, mais les gens, ils se jugent eux autres mêmes. Puis ils ont honte. Ils ont honte de consommer. Ils ont honte d'être un travailleur du sexe. Ils ont honte d'aimer une personne du même sexe. Fait que, donc, c'est ça. Puis moi, j'ai constaté que moi-même, la honte m'a poussé vers des agissements un peu excessifs où j'ai pris des risques dans la vie qui ont nui, qui m'ont amené des problèmes de santé, qui m'ont amené vers la consommation dans certains cas. Voilà, c'est ça. Qui m'a poussé à faire des choses que j'aurais pas faites, en fait. J'ai fait beaucoup de choses en cachette à cause de cette fameuse honte. Puis le fait de les faire en cachette, mais j'ai fait ça dans des endroits peu recommandables. Et puis j'ai pris des risques. Et puis voilà, hein, c'est ce qui fait ma personne en même temps. Là. Je regrette pas. Mais je suis. Voilà. Ça explique un peu pourquoi je suis ici.
Puis justement, un événement comme ça, justement, avec le public et tout, qu'est-ce que vous aimeriez que le grand public comprenne et en apprenne?
Je veux qu'ils comprennent que c'est pas nécessairement un choix de vie. d'être aux prises avec une consommation de drogue régulière comme ça. Personne choisit. Hey, moi, là, je veux être un dépendant. Tu sais, c'est comme, non, on choisit pas ça. Là. C'est des choses qui arrivent. Et ça arrive pourquoi? Mais il y a des multiples raisons. Là. Il y a des histoires, là, ça, c'est des histoires vraies. Là. Une jeune femme, elle était avec son ami, est en fugue, et puis là, rencontre un homme, super gentil, intelligent, tout ça. Il insiste beaucoup, venez coucher chez nous, de toute façon, vous êtes en fugue. Fait que vous allez être en sécurité chez nous. Fait que finalement, elle succombe, elles y vont. Et le lendemain, elle se réveille avec un bas sale dans la bouche, attaché sur le lit, et plein de piqûres sur les bras. L'homme en question, là, vous me devez plein d'argent parce que vous avez consommé plein d'héroïne toute la nuit. Fait que vous allez me rembourser maintenant. Vous allez travailler pour moi. Vous êtes maintenant des travailleurs du sexe. Fait qu'il y a plein d'histoires comme ça. Ces jeunes filles-là, ils avaient 13 et 14 ans. Ils ont demandé rien à personne. Là. Ils n'ont pas choisi, là, hey, moi, là, je vais me shooter dedans. Là. Mais aujourd'hui, ça me trouve à être des consommatrices régulières, tout ça. Puis c'est pour la vie, là. Tu sais, c'est pour la vie, là. Quand tu es prise avec l'héros, là, c'est pour la vie, là. Et les récepteurs de douleur sont finis, puis tu es obligé de prendre de la Suboxone ou, bon, tous les trucs, les traitements là, de remplacement. Pour la vie. C'est ça qui est triste.
Est-ce qu'il y a quelque chose que je n'ai pas demandé, que vous aimeriez discuter ou que vous pensez que je devrais savoir ou juste entendre?
Ben, je pense que le message important, c'est ça, c'est que il n'y a personne qui choisit d'être malheureux dans la vie. Il n'y a personne qui choisit d'être un consommateur régulier là, et dépendant. On veut s'en sortir. Tout le monde veut s'en sortir. Puis sur la réduction des méfaits, c'est possible aussi. La réduction des mythes, des faits et des risques, c'est très, très, très possible. Puis c'est ce qu'on fait, nous. C'est ce que plusieurs organismes font. Et puis, ben, il faut les subventionner. Si vous êtes tanné de voir des objets, des seringues de traîner, des pipes, tout ça, ben, au lieu d'empêcher des sites de consommation à ouvrir, ben, plutôt de les encourager. Parce que c'est prouvé qu'à chaque fois qu'on fait un site de consommation supervisé ou un organisme communautaire qui distribue du matériel de consommation, c'est prouvé qu'alentour, là, ben, ça disparaît. Il n'y a plus de seringues à la traîne, il n'y a plus de pipes à la traîne. En tout cas, de beaucoup moins. Fait que c'est ça. Fait que encouragez-nous, laissez-nous vivre, s'il vous plaît. Et puis, ben voilà, tu sais, parlez-en à vos députés, tout le monde, c'est important. Ça sauve des vies. C'est clairement que la réduction des méfaits et des risques, ça sauve des vies.
Isabelle Fortier. I'm with Mom Stop the Harm. I'm the regional representative for the province of Quebec.
And so, tell people that don't know, what is Mom Stops the Harm?
So Mom Stop the Harm is a network of Canadian families who've been impacted by the harms of substance use. Many of our members have lost someone from their family, a loved one. But we also have family who have like a loved one who's in active use or has been who's using in the past. So we advocate for changes in public law, also for end the war on drugs, to have safer supply, decriminalize the drugs and substances, even legalizing them at one point, so fighting against prohibition, and then supporting families as well who work with.
And now, if you don't mind, I heard you talk about that you've lost somebody. So if you could maybe talk about how that impacted you and led you to join the organization.
So my daughter, Sarah Jane, she was 24 when she passed. She was a student, a law student, law and international development student at University of Ottawa. She was actually at her third year of the program. She had been using mostly to self-medicate anxiety, and then like she was also diagnosed with a borderline personality disorder. So for her, substance use became like a way of self-medicating. So when she passed in the May of 2019, 2019, of course, we were shocked. She used alone in her dorm room, so nobody could help her when that happened. For me, I thought that like she had so much to do. She was like involved with different organizations, with Red Cross, with Greenpeace, with Amnesty International. So she had like so many things to say. For me, I had like questions also regarding her substance use, so I decided to go back to do a program in addiction and substance use at Université de Montréal. Started advocating with Mom Stop the Harm, and then with Dopamine here in Montreal, and that led me to become like a spokesperson for the organization here in Quebec. And now I'm actually made a switch in career, so I'm overdose prevention and response officer for Nunavik. So I work with the Inuit communities in Nunavik.
And something that may kind of have other people questioning is that people usually don't want their children to use drugs at all. Mm-hmm. So then to talk about legalizing, how as a mother who's lost somebody can tell people the reason for legalizing?
One very simple reason. Think of alcohol, who's legally accessible, cannabis, which is legally accessible. When I have those discussions with parents who are why would we legalize other drugs? I always bring them back to the prohibition of alcohol in the 20s and 30s, saying, before, when it was prohibited, people were dying because, alcohol was not regulated. So people were drinking poison alcohol. So it's the same thing. So when we think of alcohol being the number one substance which has the most effect on our societies in terms of costs for healthcare, criminal, whatever you think, it's the number one substance that creates the most harm, though it's legal, and then it's even we normalize it and we celebrate, using alcohol. So I always bring them to that and saying, there's a lot of people drinking alcohol who don't have any issues with drinking. So it's the same thing with other substances. The difference is that with the other illicit drugs, the contamination and the potency of those substances make it that people are dying from them. So as long as prohibition of those substances will be in effect, we will lose people because we need regulated substances and we need substances that we know we won't die from. So I always bring it back to alcohol. So it's even cannabis now, people are more open about their cannabis use because it's legal. They talk about it, and it's not as stigmatized as it was before. But it's always to put in perspective that alcohol is the number one substance, impacting at so many levels. Yet it's legal, but other substances that are illegal, they are toxic. People are dying from. So we need to switch the dialogue.
There's also people that would say legalizing drugs would, of course, or could, of course, lead to more users. Mm-hmm. But there's also the thing that many people talk about, I believe yourself included, that the shame of having it be illegal causes more risk than using a clean drug.
Exactly.
A hidden drug is worse.
Because people are isolating themselves because of this stigma related to the substance. And it's, again, education to be made with people could use in a safe way. People could use cocaine once in a while, just like some people drink wine or hard liquor once in a while and they don't have any issues with the substance. So it's our relation with the substance that we need to address, to that like it's not because it's going to be legal that more people will be using. There are like studies which show when we legalized cannabis, we thought, oh, like youth will start using more. It didn't create that. It was just like, no, there was no increase. It's the education that we need to do with legalization. We need to educate people about like how to use a substance without the repercussion of the harms. So there are safer way to use, and we need to just bring awareness regarding this.
And we talk about a lot of change and legalizing also safe injection sites, kind of stopping the stigma of it being so negative. Unfortunately, I feel I should ask, what do you think would have prevented your daughter from being alone and tragically losing her life?
I always say, yes, we know it's like a toxic drug that killed her, but it's stigma because she felt isolated. She felt that she couldn't talk about her use. She felt ashamed, and then she didn't want people to know. Even her boyfriend didn't know that she was using opioids. Her best friend didn't know that she started using opioids, and she was actually in a stage where she was physically addicted and then also psychologically addicted. She needed to take more just not go into withdrawal. I think that like stigma, again, if it was more accepted, she would probably be, well, first of all, maybe if she had access to a safer, regulated substance, she would not have died because she would have taken what she needed to just like not go into withdrawal and then not overdosing. What was taken was highly toxic because of fentanyl in the substance, and then she couldn't see what was in there. So I really think that yes, you have like safe consumption sites, but like for so many people, they still think that this is only for part of the drug users, so they don't want to be associated with certain categories of people. It's very complex, I would say, but again, we always bring it back down to stigma. Stigma is what stops us from having drug policies that are, efficient, that are safe. It's blocking access to different services. It blocks access to clean substances, regulated substances. So stigma is at the base of everything.
And how would you educate parents or colleagues, people close to someone who is going to use drugs and perhaps in a legal way if it does become safe? How do you still prevent the people who will pass judgment on these peers or family members? And that could still bring shame. It could be legal and it could still be shameful in certain families. How do you educate those people?
We tend to say, and that's what I do when I teach substance use and addiction and then overdose prevention. We say that like substances have been, for ages. Like human beings have been using substances for ages. For different reasons. It's always, there's like two main reasons. You use to feel good or to feel better. We need to address the feel better more. So if we need like support and kind of services that addresses that. But I would say that we cannot judge someone. We can't judge someone by the substance they're using. It's like, it's not the way, because the substance doesn't define the person. So it's always to bring awareness about, well, people are using and they've been, humankind's been using for ages. Substances will be there. They won't go away. So we just need to understand why is the person using, and then if we need to help that person, then provide the proper services. So it's always, I think, a lack of knowledge that brings people to shame or to judge people. It's a lack of education and a lack of awareness, and that's what's hard to do to bring awareness, but there are ways, like I was saying, plant one little seed at a time, and then this seed of change will, if I change your mind today, then you're, talking to someone else, your perspective will change. So it's always like one person at a time, but it's very difficult to do. And I feel that nowadays with the backlash that we see in society, that's like super difficult to kind of work against, I would say. So at first I wanted to change everybody's mind, but like my perspective now is like one little person at a time, one seed at a time, and then to bring awareness and bring the human face behind the substance, like I said. Human beings they're using.
I have a question, but it's like, I don't think it needs to be recorded or anything like that. I was wondering what's the usual response you get to people, because earlier you were talking about how when you tell people it's like alcohol, right?
Yep.
We had not the era, but the era of prohibition.
Yep.
And you've seen it also with marijuana, for example.
Yep.
Right? What do people usually answer when you tell them, well, look at those facts, like here, this is here, there's that, like it's happened before, you've seen the changes, actually,
Yep.
It's just because of how it's demonized. What do they usually answer? I'm just curious, the parents and
Well, sometimes they say, I didn't see it that way. Again, with alcohol, I would say to someone, if you come out of SAQ with a bottle, are you going to be arrested as you come out with your bottle of wine or your bottle of gin or whatever your substance of choice is? And they say no. Well, people who are using illicit drugs will be arrested, and there's impacts on their lives. And then I would say, so if you go home with this bottle and you open it, either on your own because you want to relax and feel good, or you want to celebrate something with your friends, they're coming over, are you going to die because of that substance that you'll be drinking? And they say no. I say, well, people are using other substances just like you are using alcohol, yet they're putting themselves at risk because of that being illegal, the potency and prohibition bringing more and more potency in the substances. So it's like I always bring it that way around, with alcohol, I think, and then they say, oh, okay. And not everyone drinks alcohol. It's a choice sometimes, but sometimes people do use to try to solve their issues. So we just need to support them if that's the case. So for whatever substance, we just need to look at it that way.